And we begin with the breaking news happening in West Texas. A child has died from measles, and this is the first death linked to the outbreak that started last month. ABC 13's Courtney Carpenter is live in the newsroom. And Courtney, what else do we know about that child?
And the child tested positive for measles last week and was hospitalized in Lubbock. The state confirms that she was not vaccinated. The Texas Department of State Health Services reports the outbreak has grown to 124 cases across 9 counties. 80 of those cases are in Gaines County, which is a relatively small county about an hour northwest of Midland. The region is home to a community of Mennonites, among whom vaccinations are not as popular as they are in the general population. Most of the patients are babies or children. There are also 9 cases now in neighboring eastern New Mexico. And there's now a rush to get vaccinated. Lubbock health officials are offering free vaccines. Reports saying most of the 100 children who got the MMR vaccine last week were from families who previously chose not to vaccinate. A mobile healthcare unit's now going around the area offering vaccines and immunoglobulin shots or infusions to people who may have been exposed. It's also feared the measles outbreak could spread. Earlier this week, state health officials said a person infected with the measles traveled outside of the outbreak area to San Antonio. Measles is highly contagious respiratory virus that can survive in the air for up to 2 hours. The best defense is vaccination. 2 doses are typically given to children. Those 2 doses are 97% effective.
For the vast majority of people, if you've gotten your measles shots, you should be protected. It should be something that works for life.
Well, if you're an adult and you haven't gotten it or you've only had 1 dose, doctors are recommending folks go ahead and get this MMR vaccine. Health officials are now doing what they call contact tracing, which means they're tracking down anyone who is in those public spaces at the same time as that patient. Back to you.
All right, Courtney, important information there. We appreciate that live report. Thank you.